Hey guys, I wanted to do a summary of our discussion last week related to patient expectations. It was a really great discussion. I thought the leaders did an excellent job with their questions and following up to your responses. We had a lot of kind of good topics and tangents that came out of that. One of the bigger things that we talked about was what is the public's perception of physical therapy. And this is something that's been a bit of a hot topic in the profession for the last several years because PTs do so many different things and our skill level and knowledge level has advanced rapidly, let's say in the last 15 years, that the public and also even other healthcare team members aren't really aware of what our scope of practice is. And I think you guys all hit the nail on the head that it's really up to us as a profession and as individual PTs to try to do a better job of informing the public. Part of that could just be when the patient comes in for their first visit of physical therapy, and I think some of you guys mentioned this, you might sit down with them and say, have you ever been to physical therapy? And they might say no. And then you can kind of explain to them what their treatment will, or what their examination and treatment will consist of. You might even describe to them a little bit about your background, scope of practice, so they have a good understanding, because many patients come in and don't really have a great understanding of what to expect. And then I think the other thing that we sort of talked about is managing those patient expectations. And one of the first steps to doing that is making sure you know what those are. So I think visit one, you probably want to ask that question and say, what are you hoping to get out of physical therapy? What are you expecting I can do to help you? Have you had PT before? What's worked? What hasn't? What have you heard about it? All those things that are kind of getting into that patient's head to figure out, okay, what does this person really want? That doesn't mean that you have to do exactly what they expect. But if they come in with a certain beliefs or expectations, you need to have that, you need to know that, and then you need to be able to sort of shape those expectations. So I think a couple of people talked about, all right, well, maybe the patient is coming in and is expecting some sort of non-evidence-based treatment, and then it might come down to a little bit of a negotiation with that patient or doing some education. You know, if the patient really says ultrasound is what helped them in the past, you may decide to do that because it's not going to be harmful. Maybe it takes 5 minutes or whatever, but hopefully with your conversation, your communication, you can kind of help them to realize that that isn't probably really what's going to be the most beneficial for them. So I thought it was a great discussion, and I think you guys have some really good ideas for managing expectations and also for getting the word out to the public about what the PT profession does. And I think our professional association is making strides in that regard, but I think we could probably do a better job in explaining what we do. And one of the problems is PTs do such varied things depending on the practice setting, in an inpatient versus outpatient, pediatrics versus adult. There's so many different fields that we work in that I think it's kind of hard to define exactly what it is that we do. So it might have to kind of be broken down by specialty or something like that. Well, that's all for the summary. I look forward to speaking with you guys next week in WebEx, and great job on the discussion boards. Have a great weekend.